Hey, good morning. I begin this morning with a thank you. Thank you to our residents. Overall, you've answered the call and adhered to the state and city guidelines to stay at home. Staying at home, we know, reduces the spread of COVID-19. Staying at home, of course, saves lives. And staying at home reduces the potential for overwhelming our hospitals and our healthcare workers. Now, in the last week, Birmingham City Council has joined me in securing the funds to invest in Birmingham Strong Service Corps. This is a public-private partnership designed to provide pay for workers who have been displaced due to coronavirus. It's a partnership designed to provide those individuals in support of projects related to emerging and evolving needs in our community due to COVID-19. These are jobs like working in a call center for COVID-19 symptom screening. Other options include school lunch preparation and delivery, or providing shuttle service to safely transport patients. To learn more about how you can apply or support this program, please go to bhamstrong.com. Birmingham Strong is one example, just one example of how we've all come together to support our city and our people. Now, many of you have heard the discussions about reopening our economy, and I have many thoughts. While we continue the current state and local stay-at-home order, know we will work closely with our public health officials to make the best decisions to keep us safe while taking the next steps to address the economic crisis COVID-19 has created. The leadership at the Jefferson County Health Department, under the direction of Mark Wilson, has been a valued partner, and we will continue to move together. I would like to ask Dr. Wes Williford at this time with the Health Department to join us for an update.
Thank you for the opportunity to be able to speak. I do want to echo Mayor Woodfin's message regarding the stay-at-home orders. And of course, those orders were issued by Governor Ivey and Dr. Scott Harris, and they do remain in place until April 30th. I do want to take a moment to explain why these orders are so important. The disease that we face, COVID-19, is highly contagious, and we lack a vaccine or well-proven treatment at this point. The tools that are normally used to fight infections such as this, medications and vaccines, simply do not yet exist. Furthermore, time and again, we have seen what this virus is capable of with unchecked spread. New York City has experienced almost 15,000 deaths in the course of months. The first U.S. death due to COVID-19 occurred on February 29th, and since then, there have been 42,346 deaths in the U.S. That's a total of 52 days. The fact remains that COVID-19 is in our community. There are still cases that are occurring here each day, but thankfully the numbers of new cases each day do continue to decrease, and that is in large part due to the social distancing efforts and the hard work of our community. The best tool at our disposal is to starve the virus of an opportunity to cause infection. And how do we continue to do that? We must continue to focus on the fundamental principles of infection control, such as hand washing and cough hygiene. Additionally, for now, we must continue to work diligently to keep our distance from one another. Why do we advise keeping 6 feet of distance from each other? That is the distance that a droplet from your lungs can spread when coughing, and that's the distance that COVID-19 can travel with a cough. Beyond a physical distance between those in our community, we have to work to limit the number of interactions that we have with those outside of our households. I want to thank everyone in Jefferson County and the entire state of Alabama. Alabama and the United States are enduring a remarkable tribulation. The virus has taken the lives of loved ones and has caused untold financial harm. However, keep in mind that the virus can impact us all, regardless of age or health. Again, our only tool at this point is to prevent this is separation and distance from others. Our path forward to limiting a recurrence of COVID-19 is to stop it from transmitting, and I ask that we all work hard to limit our exposures to others outside of our household, and I'm confident that in time, our efforts will result in a remarkable number of lives saved. Thank you.
Thank you, Dr. Williford. During this crisis, we've seen incredible courage and commitment from our healthcare workers battling COVID-19 on the front lines. Our police, fire, and rescue and public works employees have not wavered in their service to this city. Our grocery store employees who work many hours to keep our shelves stocked, and so many of you have made contributions and have volunteered your time to support those in need. However, during this time of crisis, there's been a dark side that I've seen, and we must acknowledge that the number of homicides in our city over the last week. While overall crime is dramatically down, the violence we've witnessed in the last week is not acceptable. Many of these crimes, unfortunately, cannot be policed because they involve personal relationships and heat-of-the-moment decisions that end lives. Our police department remains committed and is taking the necessary steps to address these numbers head on. And these just are not numbers, these are lives. But there is another form of violence we must confront. Since the shelter-in-place ordinance took effect, the YWCA has seen a 50% increase in domestic violence calls to the crisis line. Now, the nature of these calls has shifted from individuals seeking information to requests for safety. The shelter-in-place orders do not mean that you stay in your home and endure domestic abuse. Again, the shelter-in-place orders do not mean that you stay in your home and endure domestic abuse. Many services are available for anyone needing help due to domestic abuse. If you find yourself in this situation, please call the 24-hour hotline at the YWCA at 205-322-HURT. That's 205-322-4878. We know information is our greatest tool at this time. Finally, I want to remind everyone, you can still stay informed on matters related to the COVID-19 in the city of Birmingham by texting BHM COVID. Again, that's BHM COVID to 888-777. Seek our updates on our social channels and online at birminghamal.gov/coronavirus. Now, before we open up to questions, let me offer some comments concerning Dr. Lisa Herring. Dr. Lisa Herring is a friend and a peer, leading change in an institution that has struggled to live up to its promise. This institution, as we know it, is the Birmingham City School System. And if I'm being very honest, her departure saddens me. We were beginning to see the kind of progress and success we had hoped for in Birmingham City Schools. Dr. Herring, what I like about her is that she embodies a rare mix of high intellect, high empathy, and extreme vision for success. While at the same time, I know that Dr. Herring's career has been built on success. Success attracts opportunities, and she is deserving of new opportunities. Dr. Herring has set a new standard for the type of leader our students deserve. And I want to wish my friend the best. But here's what hurts. Since the passage of the Lewis-Spratt Act in 2001, our school system has had 8 different superintendents in 18 years. They've lasted an average of a little over 2 years. And on top of that, our elected school board turns over every 4 years. This has been a recipe for instability and consequently poor performance. That was until Dr. Herring came on board. I think we all want our school system to be better. Our students deserve better, and Dr. Herring showed us what a good fit looks like for our system. And soon, the school board will require the full support of our community as they embark on a search for a new leader. Count on me to serve as a vocal accountability partner to ensure that we get this right. With that, I want to open it up for any questions.
Thank you, Mayor. We have callers on the line right now. I know that there are a number of them. We will begin and we will call you out individually by news organization. I will begin with AL.com. I believe Anna Beam is on the line, AL.com. Do you have a question for the mayor?
Sure. Mayor, do you plan to extend the shelter-in-place order?
That is a great question. The question is, does the city of Birmingham plan to extend our local stay at shelter order? I think it's important for me as an elected official to do less talking and more listening. And I'm referring to listening to those health experts. I think it's important that there be no distance between Dr. Mark Wilson and the health department in the city of Birmingham. In addition to that, we continue to have conversations with the state but it's important to balance this healthcare crisis and this economic crisis. And so that decision has not been determined. I think, like many other elected officials across the state as mayors, we continue to receive information, and the more information come in, the more we'll be in a better position to make the best decision to protect and save lives, while also making decisions that balances how do we open up our economy again.
Is Birmingham Times on the line? Birmingham Times. Go ahead with your question.
So with the crime, is the police department, are they like using more resources as crime has gone up in the last week?
The question centered around police officers and the resources provided to them as it relates to crime. I think it's worth restating that in all crime categories of assaults, robberies, burglaries, theft, breaking into vehicles, and every other crime category with the exception of homicides has seen a drastic decrease year to date as it relates to April 21st of 2020 versus April 21st of 2019. And the police department, as well as community partners, as well as our residents, are to be commended to stepping up, sharing information, calling 911, and engaging in so many other ways to decrease crime in our city. As it relates to the homicides in our city, I think what we've seen and looking at the information provided to us based on what's happening, a lot of things stem from these personal relationships, as well as, unfortunately, a lot of in-the-heat moments. The resources we have provided have been to our detectives. Our detectives have been placed in a position that's extremely unfortunate because of the increase in them, but they continue to be provided with the resources they need to solve these cases. Let's remember this is just not about numbers or cases. These victims, unfortunately, these victims have families. Their families are in mourning, grief, they're sad, and their loved ones should have not been taken from them like this. And so it's important for us in engaging our police department to bring some sense of justice by making sure we capture those who committed these crimes.
All right, just a reminder to everybody that's on the line asking questions. After you ask your question, please mute so that we don't have feedback coming from the phone line. With that, let's go to our next news organization. Is WBMA on the line? Is WBMA on the line? ABC 3340, are you on the line? All right, let's go to our next call, WBRC. WBRC, are you on the line?
Yes, I actually had a question for Dr. Woodfin, if he's still there.
Yes. Please go ahead.
We know there's a lot of treatments or drugs that are still in clinical trials across the country. Some of them having promising results, others with mixed results. But in particular, I want to ask about Remdesivir. And is there trials where somebody can go to their doctor and say, well, I have symptoms, and they get tested positive, where they could actually try that drug out that you're aware of in the county?
So what I can answer on that is that, so that medication, unfortunately, right now is only available in an IV, intravenous formulation, so it can only be given through the vein, and because of that, it's been limited to very severe illness for people who are in the hospital. Unfortunately, there's not an oral version of that you can take as a pill, and so that does limit the ability to use it in the community. I will say that there are I think there's an ongoing trial of the medication with the University of Alabama at Birmingham right now, but again, it's that IV formulation.
All right, thank you for your call. Let's move on to our next question. WIAT. WIAT, do you have a question for the mayor or Dr. Williford?
Yes, I was going to ask if Birmingham has received COVID-19 numbers specific to the Birmingham area code or zip code, and if that information will be released to the public.
I can answer that. That's something that at the Jefferson County Department of Health that we're working through right now. There's a release of information process with HIPAA and the Department of Health and Human Services that we're currently going through to make sure that we're protecting the privacy of all of our citizens. That's something that Dr. Wilson is actively working on right now. We hope to have more news on that in the coming days. It's just to be a matter of getting the go-ahead from the Department of Health and Human Services. Again, we just want to make sure that we're doing everything we can to protect the privacy and safety of all of our community members.
Okay, our next question, please, let's turn to WVTM, and a reminder to folks after you ask a question, if you can mute your phone so we don't get the feedback. WVTM, do you have a question?
Yes, Mayor, this is Randall. I had a question for you, being the former president of the Birmingham City School Board. What are you looking for in the next superintendent to lead the Birmingham City School System?
The question is, what am I as a former school board member and as mayor looking for in the next superintendent? The truth is, it's no different than what we currently have in Dr. Lisa Herring. As I've shared with many people, Dr. Herring has vision, not just vision, but the ability to execute on that vision, as well as a communicator. I think when you look at some of the strengths she had, one of those strengths existed around her communication skills as it related to not just her direct team, but to the principals. Not just the principals, but students. Not just the students, but community stakeholders, the corporate community, other elected officials. And so around vision, around ability to execute on that vision, being an effective communicator and a consensus builder, these are just some of the things. Of course, you want someone with a background that's very similar to hers. That includes the academic piece, knowing that at the beginning and end of the day, the number one priority is to educate our children, and she possessed that background as well, making sure that the right principles were put in place to lead these individual schools. So there are many things to consider, but it's no different than what we currently have in Dr. Lisa Herring.
WBHM Radio, is WBHM on the line? Let's go to our next. Is Summit Media on the line? Summit Media. Is there anybody currently on the call who we have not called yet who has a question? If you have not been called yet, please unmute and ask your question. Okay, let's go back. Roy Johnson of AL.com, are you on the line? Do you have a question?
That's something that at the Jefferson County Department of Health that we're currently working on trying to coordinate. The issue ends up being for us is that the amount of testing supplies that we have at Jefferson County Department of Health is very limited. We have a very small number of swabs and a very small number of collection kits that we've reserved for very critical populations. When I say very limited, I mean below 200. And it's something that we are trying to find other partner organizations to work with to facilitate bringing enhanced testing into other areas. It's something that we're actively pursuing. I will say, of course, too, that I always want to make the reminder that at present, regardless of insurance status in Jefferson County, a Jefferson County resident can receive COVID-19 testing without having to pay for it. So that's if you do not have insurance and you need COVID-19 testing, that is something that Jefferson County is picking up the bill for. So again, a lot of active efforts still going on with that.
All right, we've been going for a little while. We're gonna go one more round of questions, just to make sure we get everybody's question. I believe that WBRC Alan Collins is on the line, had a question. WBRC? WBMA, ABC 3340.
Yes, Rick.
Oh, go ahead, Alan.
I'm sorry, I'm an old guy, Rick. I can't hit all the buttons. Mr. Mayor, you've heard these guys to help them?
So the first part of your question dealt with what are some of our small business owners are telling us. In our efforts, we've continued a direct line from the city of Birmingham to our small business owners. We know there is an overwhelming amount of anxiety and fear for these small business owners who have, some of them have been closed anywhere between 4 and 6 weeks. And in that period, due to a loss of income, the ability to pay their mortgage or rent on their commercial space, the ability, unfortunately, to have to furlough, lay off, or terminate their employees. And then in addition to that, all these other life decisions that come from a ripple of not receiving income based on the business and the service they provide. All of these things, the lifeline we've attempted to extend with BHAM Strong. There are other organizations that have an extended lifeline. We know the CARES Act has extended lifeline, but unfortunately, many small business owners have been left out, and that's frustrating. That is cause for more concern and more worry. What I would like to share with them is that our office continues to pick up the phone, text, email, championing to our delegation here with our our U.S. representative as well as our U.S. senators, that we are in need of another package that gives direct resources to our small business owners, and to make sure they, put some speed under that so these small businesses won't go under. I think the second part of your question was related to when can these businesses open up. I think there has to be a balance here. Again, I'm not an epidemiologist. I don't have a health background. I don't pretend to know all the science behind the COVID-19. What I do know is to be smart enough to shut up and listen. And I think in listening to our health experts, we have to find the balance between opening our economy and keeping people safe. And I believe, as hard as it is for our small business owners throughout this community, none of them want to be in any jeopardy to provide any harm or undue burden or hardship to their customers, because all of us are in this together and there is a codependency. So I believe if the elected officials actually listen to our health experts, I am more than confident we can strike a balance with this healthcare crisis and this economic crisis.
All right, we have one of our callers was not able to get on the line, so we're going to read this question. This comes from Chris Coleman of WATV. I believe this is a question for both the mayor and Dr. Williford. Wanted to ask if there is going to be tightening up on people being out without masks.
So let me start with the encouraging part first. I walk out of this building here at City Hall, and let's take yesterday. I come into a commercial district, and I was happy to see people voluntarily actually wearing some form of a face cover. I'm going to steer away from the word mask because I want to encourage face covers. I think the CDC guidelines have been very clear for quite some time that the recommendation, with some exceptions, if you're not outside with some form of physical activity, if you're walking into some form of a place that's deemed essential, you've been encouraged to wear some form of a face covering. I can imagine a scenario, if it's by the city, by the county, by the state, but I would like to lean on the health experts, that if we have to go from recommendations to requirement, I wouldn't see a problem with that. The ultimate goal is to save lives and decrease the spread of the COVID-19. And listening to Dr. Williford, he shared with us a droplet from a cough. But imagine a sneeze, imagine a laugh, imagine talking to someone in a confined space where there's not a lot of distance. Wearing some form of a face cover can prevent this spread. And if we were in a position to open back up our economy at some point, I think to continue to keep people safe, face coverings are a smart thing to do.
I think Dr. Williford is going to make some comments on that as well.
And I agree completely with that. With the face coverings, of course, we talk about what the real act of that is not necessarily protecting you yourself from coming in contact with COVID-19, but protecting all of those people around you that you come in contact with. Just like Mayor Woodfin said, the cough, the sneeze, the particles that are expelled from your lungs That is what we're trying to prevent spreading into the air. If we prevent that, we prevent more spread. So I do encourage the use of the face coverings. No requirement is in place at this moment, but it's something that may likely be a part of future plans. Thank you.
All right, next question comes as a follow-up from Anna Beam of AL.com. Anna?
Sorry, I was muted. Mayor, what do you expect to see from the tax receipts for March? I believe yesterday is when those tax receipts started coming in. Do you have any anticipation of how far the city is going to be hit and what you plan to do to respond to that?
And that's a great question. Of course, like all other cities in the state of Alabama, as well as the state, on the 20th of each month, we receive our tax collections from the previous month. So April 20th, yesterday, we got our receipts in of what the city brought in as it relates to our sales tax, our occupational tax, our use tax, as well as other ways of us collecting money. Unfortunately, we're not in a position once it's given to us, because it's a lot of information to just assess right away. You'll see us looking at that over this week, and hopefully we will be able to have some hard, tangible numbers that I can share with you, that I can share with the public, that I can share with our employees and all other interested parties, of where we actually are on each of those categories of what we've brought in. We know that March will look different than April. And so what I mean by that is economics in the city related to closing things down and shutting things down and going to essential versus non-essential look different the last 2 weeks in March versus the first 2 weeks compared to 2019. I think as you look at April, I think April will be hit harder, but we won't know our April numbers until probably the end of May. And so over this week, today, tomorrow, the end of this week, we'll collect all of that information and see where we are. And I hope to be in a better position by next week to provide you a more concrete number to how we actually got hit, how hard we got hit. I do know this: we got hit like all other cities in America, and tough decisions will have to be made. And any person that's in my position as a mayor, but we'll make decisions that strike a balance of finding ways to support our employees and to continue to deliver services for our residents.
Let's go back and check on any other follow-ups. WBMA, we called you earlier. WBMA, are you on the line? ABC 3340. Do you have any question?
Yes.
Go ahead.
Yes. Mayor Woodfin, do you have any comments on Georgia's plans to reopen businesses on Friday?
My comments? My comments are very simple. I would hope that the leadership in Georgia has listened to their healthcare professionals and the health experts. And if they have recommended to open up, then great for Georgia. But if elected officials in the state of Georgia or any other of the 49 states across America, at whatever level, if the elected officials across America are not paying attention to and or listening to those who understand this disease, who understand this virus, who know the decisions we should be making, and are not putting public safety, which is the #1 job of any elected official in America, first, then there's not a balance here. Of all people, I understand the anxiety and fear the economic crisis has caused as well, but the healthcare crisis related to our job as elected officials, engaging what real public safety means, then we protect the welfare of our citizens first. That's bar none. There is no competition to the public health and safety of our residents, local, state, or federal level. And so my response, whether it's Georgia or any other 49 states in our union, we as elected officials must make decisions that balance the protecting of lives, who we're ultimately responsible for, and finding ways to balance the economic crisis.
Birmingham Times. I wanted to follow up with Birmingham Times. Erica, do you have another question for the mayor? WVTM, do you have another question for the mayor? John, do you have another question for the mayor? WVTM. WIAT, do you have an additional question for the mayor?
Yes. Just to clarify, so Jefferson County and Birmingham really started closing things down before the rest of the state. If KIV decides to reopen this state, do you think Jefferson and Birmingham will follow suit, or do y'all plan to just keep taking a look at our numbers here before making that decision?
This conversation is very fluid. The city of Birmingham, as mayor, I continue to have conversations with the 9 other mayors of the largest cities within our state. The 10 of us continue to have conversations with the governor. And we know there's some exceptions as it relates to health officers outside of the state health officer, particularly as it relates to Mobile County and Jefferson County. We know outside of Chambers County, Lee County, and Madison County, 2 of the hardest hit counties within the state of Alabama, of all of our 67 counties, are Jefferson as well as Mobile counties. I am hoping that the governor gives some latitude to those health officers whose jurisdiction, not only they have some unilateral control, but more importantly, if every county's health issues are not the same, meaning there are some cases that are higher in certain counties versus other counties, and those counties have health officers that are able to make decisions to protect people, then I am hoping that we are in a position to make sure those local health experts, those health officers, are in a position to address and assess and make recommendations on what we need locally, because everything is not the same across the state.
Okay, this is last call for questions. This will be the final question. Is there anybody on the line who has not had a question asked? Are there any additional questions? One last question.
Rick Allen here. Can I ask Dr. Williford about testing?
Okay. Go ahead. Go ahead. He's here.
Okay, Dr. Williford, you mentioned testing might go mobile to get more convenience. How are things going with testing? Are you seeing demand go up or down? If it's going down, obviously that's good. But what are you seeing here in Jefferson County about demand for testing?
That is something that I need to follow back up with the testing sites. Anecdotally, I've heard a small decrease in the number of daily requirements for testing at some of these places, but I need to look at some hard numbers and talk with those groups a little bit more to give a better picture of that. But it seems, at least from what I've been hearing people say, there have been a little bit of a decrease in the demand for testing at certain sites.
All right, thank you, Dr. Williford. That wraps up our questions. If there are any members of the media on this line who have any follow-ups, please don't hesitate to call the Office of Public Information, and we will address your issues with that. The mayor will provide some final comments, and we will wrap up this news conference.
Again, I want to thank the public for adhering to the stay at home, stay in shelter place ordinance. I think I want to make this very clear. Beginning of this month, I shared with the public that if we wanted to be out of this, if we wanted to phase in things to look differently in the month of May, then we were going to have to make some tough decisions in the month of April. We didn't have the luxury to skirt around or tiptoe around or try to not be in compliance of this ordinance. The goals were simple: to save lives, to prevent a run on our hospitals, and to protect our health professionals. But here's the bottom line. With 21 days into this month, we know there are 9 days left. And in these next 9 days, it's going to be very, very important for everyone to follow and self-police yourself. Do what's necessary in the month of April. Stay at home. If you don't have to go out, don't go out. And believe this: we have to protect those who are vulnerable. For the last 5 weeks, I've only stepped into my mother's front yard. I haven't gone into her home. She's over the age of 60, and she has underlying respiratory issues. But I know I'm not alone in that category. Many of us have family members who have either underlying conditions or are seniors. Many of us know people who have had someone or known someone that has passed away from this. This is serious. There's a lot of grief out here, and we don't need to add to that grief. And so I want to express my condolences everyone who has lost a loved one to the COVID-19. This is so serious, and I'm saddened by the stories I hear of loved ones not even being able to attend the funeral or the homegoing service of a loved one who has passed because of the COVID-19. Self-police. Protect yourself. Protect others. Stay at home. Thank you.